All right. Hey, everyone. It is Janine Hubble-Cox with It's All Legal Too, and welcome to another episode of The Whole Truth. I hope you guys are having a safe and blessed Wednesday, aka Hump Day. We have a really great show for you guys today. And this topic is so well timed with the unfortunate turn of events that have happened with COVID, as far as the numbers going back up in all 50 states. But there is some hope on the horizon with two vaccines that are almost ready for emergency trial release. So our guest today is an expert on infectious diseases. She is NASA's first female toxicologist, and she has been on several shows, including The Doctors. I know she is a regular on, she's in Houston with me, and she's a regular on Fox 26 News, ABC 13. She's been on also other national media outlets as well to give her expertise in the area of toxicology and infections. So without further ado, I am going to bring in our guest for today's discussion, a COVID conversation, Dr. Noreen Mayberry.
Hi, everybody.
Hey.
Hey, Janine.
Hey, Noreen. How are you?
I am good. I'm very good. Very good. I am, honored to be here. Love talking to people. And I think, like you said, this is a very timely discussion. We've been going through this, pretty much almost all of 2020. So it's definitely important to talk about it now as holidays approach and as people are experiencing pandemic fatigue.
Absolutely. And I mean, who would have thought then when this started, what was it, back in February or March when the first U.S. cases were first starting to be reported that, 7 or 8 months later, we would still be dealing with this. So,
right.
Yeah, COVID fatigue is, I think it has probably hit the majority of the United States population. But like you said, again, this is a very important discussion that we're going to have because of the fact that we are still dealing with it. And in fact, it's been reported now that in all 50 states, the infection numbers are going back up.
Yes. Correct? Yeah, absolutely. They are. And it's an unfortunate trend. And I think it is because, a lot of people are, tired of doing what they are supposed to be doing in terms of social distancing, staying at home. People are missing each other. They miss that physical touch. However, the number of cases is moving so rapidly. The rate of infection is going up at such a rapid pace that we are thinking that we may be outpacing what we saw in July in terms of those peaks that we saw in several places around the country. Seeing what New York experienced at the beginning of this year, because people don't want to wear a mask as often as they should, and because the strain of COVID that is out now. It's basically, what happens with COVID is that it doesn't just stay that original infection. It replicates, it duplicates, there's slight modifications, slight changes. And so what's out now is way more contagious than what was out at the beginning of the year. And, at the beginning of the year, I worked to, combat a lot of rumors. There were rumors saying that, if you have more melanin content, if you're Black, you can't even get COVID. And we know now how false that is. And I mean, there were people who claimed to be experts that were saying that. And, that was my initial concern was, please, people, let's just protect ourselves. The fact that we don't have enough PPE for our essential workers, for people who are on the front line, for people who are having to go and pick up people from their homes, for people who are working with them day to day in and out in the COVID wards. We still have a shortage. And if we had more of the PPE available to them, we would be in a much better position if we had more testing, if we had more people getting tested. There are a lot of people that still have never been tested. And just because you don't have symptoms does not mean you aren't spreading the infection. And so that is why it's so important to get tested. In the beginning, when there were limited tests, you wanted the people with, with symptoms to get tested first. Of course, they needed priority. Just like with the vaccine, the people who are going to be getting them first would be the frontline workers who are most at risk and patients that are most at risk. It makes sense. But right now that we have more testing available, there's even a home COVID testing kit that has just gotten FDA approval. You definitely want to get tested. If you can find out if you have antibodies, that'll let you know whether or not maybe you've had COVID and you were one of the asymptomatic people. And, we don't know how long immunity lasts, but the testing that we had a few months ago showed anywhere from 2 to 3 months of immunity, much shorter than we were hoping for. So these are things you all have to keep in mind. And when you wear a mask, you must wear it over your nose and your mouth. I cannot tell you how many times I see people with it under their nose, or they're talking and it's just sliding down like this. No, put it back up, protect your nose, protect your mouth. People say, oh, I shouldn't have to wear this. You're impinging upon my rights. Well, we have to wear underwear in public because, it's a law that we, cover up the dirty bits or the parts that might be offensive to others. So right now, your mouth and your nose is just as offensive. So cover them up when you're in public. It's clothing for your face. It's another fashion statement. It is not going to give you hypoxia. You are not going to faint. People in medical communities have worn these for hours and hours at a time. For years, none of them passed out. We would not be putting our healthcare workers at risk. So if you are wearing a mask, again, it doesn't protect you to wear a mask. But if you're wearing a thicker one, an N95, you do have some protection afforded now. Really, it protects the other person. But if that person is protecting you and you're protecting them, then both of you are getting the maximum amount of protection. The further away you are from each other, the better. Think about this. When you flush a toilet or when you sneeze, that can go as far as 25 feet away. So imagine we're just 6 feet apart. If someone sneezes, that can still land on you. If someone has a mask on and they sneeze, it gets caught in the mask. Okay. So then you're protected. So it's very simple. It's not something that you should look at as someone impinging upon your rights. It really is about protecting yourself, protecting your fellow, citizens of the world. But protecting your families, the ones that you love. And guys, there was another report about pets. I'm going to bring up pets now because we love our pets. But a lot of people act like you aren't supposed to be taking precautions with your pets. I see people kissing their pets in the mouth. And this is not the time for that. I cannot
stand that. Even without COVID going on, right?
Forget COVID, but right now more than ever, animals may be a vector for the disease because they are out. The people who had a greater infection rate were the ones who walked their dogs more, because you would think, oh, it's outdoors, it's not so bad. But again, they're oronasal. They really do a lot of foraging around with their nose, and then they get in your face, and everything they've just been exposed to, then you're exposing yourself to, you're kissing them, and then you're breathing it in. And this is not a good thing. There's a lot of airborne around them, which you can't see. It's like a cloud of, a dander that has different kind of infections, chemicals, biologicals that are adhering to it. Just like we have that same cloud because we shed skin. Every 2 weeks we get a whole new outer layer of skin because we're shedding the outer layers. If we had a light around us, you would see everything that was adhering to it. This is why when you come home after you've been outside, I always tell people, don't get into your beds with the clothing that you wore outside. Don't get into your bed without taking a shower first. Wash off everything. Every night you should be taking a shower before you get into your bed. The people who said, oh, a little dirt won't hurt to me before, they're dead silent now because a little bit of dirt, a little bit of COVID, it hurts. It can kill. It's killed a lot of us. And again, we're undercounting. I can't even imagine if we had the number of, if everyone was tested, how many people we would see that would be infected. And it would help us from a knowledge standpoint as well. Everybody who's working in tropical medicine or infectious diseases or toxicologists like myself. I mean, it's just, there's a lot that's unknown. The ER docs, the nurses, the people who are really working with the patients, this isn't their specialty, but they have to work with these patients that are suffering from COVID. So again, I highly encourage people to get tested if you can. There are free testing sites all over the United States now. And it's accessible now to where a few months ago, it just wasn't.
Right. Because I know here, I mean, I never had symptoms, but I went and got tested because I just wanted to know.
Exactly.
And thank God I came back negative. But,
Yes.
Again, you could be asymptomatic. You could be a carrier and you're in the house with other family members.
Right.
And, you just never know. So I don't understand the rationale of people, not going to get tested, especially if it's free.
Right.
Just for your own peace of mind. But I want to back up just a bit. Why? So they, when this first started, or like you said, probably after Memorial Day, which would have been May, June, they were talking about, okay, looks like we're going to be getting a second wave of this. So the second wave is what we're experiencing now with the uptick in numbers. But do you think that because there after Memorial Day, everyone, we had the 3-day weekend and everybody went out, and then 4th of July, and then we had Labor Day. Do you think that those outings and gatherings facilitated the uptake in numbers at all?
Absolutely. Anybody in public health will tell you this was predicted. Remember, around March timeframe, about the second, third week of March is when everybody started to go indoors and basically almost shelter in place, staying at home, working from home, limiting exposure, limiting the amount of times they went out to eat or they got food delivered to their home. Everybody was taking the utmost precaution.
Right.
So, May came along. You started to see holidays, graduations. People just started to say, oh my God, I've missed this so much. They get a little bit of a taste of it. It's almost like when you fast and you've been doing so great, and then you have that one piece of cake and you're like, oh my God, I miss this so much. I need more cake. Just a little bit more cake won't hurt me. Just a little bit more.
Right.
So it's almost like that. But I miss that contact, and I was fine when I went out on Memorial Day, and I want to go out for 4th of July, and it's summertime, and I want to do this, I want to do that. You can't tell me I can't live. COVID won't let me live. COVID won't let you live if you catch it and you're high risk. Okay, but you can live with COVID if you take the right amount of precautions. If we had all worn a mask starting in March, let's say we had truly mandated and everybody just listened. Like when I go outside and I work out, I walk or I run or whatever I'm doing, I still wear a mask. The majority of people around me do not. So I'm protecting them, but they're not protecting me. So when I see them, I move. I get out of the way. I don't want to be near you,
Right.
So this is not the time to play chicken. Now I see people trying to get in people's faces because they think it's a political issue. This is not a political issue because COVID doesn't discriminate. COVID doesn't care about your politics. COVID just wants a host. It wants to replicate. It wants to take over your system and overwhelm it. And a lot of people are on prescription drugs, biologics, have been through chemotherapy, or survivors in some kind of way, and their immune system is lowered. And so those people have a greater opportunity for COVID to overwhelm their system, and for them to have symptoms that, maybe somebody with a really strong immune system does not. However, there are people with really strong immune systems, no medical history, that are still being overwhelmed and ending up as the worst case scenario fatalities through COVID-19. We are seeing young people. We are seeing people who are seemingly healthy, again, zero medical history, that are ending up being some of the worst patients and suffer the worst consequences. And we don't want to do that. I've seen teachers that are super young, passing away, and then people are using this pre-existing conditions. Pre-existing conditions is basically an insurance term that is in place for people that don't want to insure you. But it's your medical history. We look at your medical history. Everybody has a medical history. And so you shouldn't, when it really drives me crazy when I hear city officials or anyone saying, these people died, and these, we have 6 deaths today. 7 of them had pre-existing conditions.
Yes.
It's not their fault. They would still be here with that medical history had COVID not come along. So COVID
Right.
was the ultimate decider of whether or not this person was going to live or die. It wasn't the pre-existing condition, because they were living with that pre-existing condition prior
Pre-existing
to
condition,
COVID.
pre-COVID.
If we could just stop saying that, I mean, and that is so painful for the family members, because these are lives. You know, it isn't just a number. It isn't just a 250,000. It isn't just a million people that have, you know, gotten COVID. These are people's family members, and the long-term effects for some people that are survivors. You know, there are a lot of people suffering from COVID brain, where they can't recall the most basic simple words. I kind of relate it to, the easiest analog would be pregnancy brain, when you couldn't remember simple words when you were pregnant.
Yes.
You know, I'm like,
Right.
what's that color? It's a mix of red and blue. I can't remember the word, but simple things like that. Oh yeah, it's purple. These are the things that people are struggling with. There are
Right.
people who are still having issues breathing. There are people who are having issues with extreme fatigue, and that's hard. Yeah, when you're trying to get back to work and you're suffering from extreme fatigue, you guys, you don't want to catch it and get over it. It's not something that it is something to worry about. It's not live your life and don't worry about COVID. It's be mindful of COVID, take the precautions, wear your
Right.
mask, socially distance, wash your hands, wash under the nails, wash your hands, wash your body when
Frequently.
you come home. Don't track things in on your shoes. Take these clothes off, isolate them, wash yourself, take the precautions that you were taking in March, and just keep doing the right thing. And you can
Right.
live with COVID, and we wouldn't be in the situation where we've got schools getting ready to, you know, have to shut down again. We are, you know, in Houston, they were saying they were up to like almost 8%, 7.9%. South Dakota, worst
Right.
per capita this past week. It's sad what we're seeing in places that over the summer had virtually no cases, because they were like, oh, come on over here, have your, you know, your events, have your
Your
rallies, have
events.
whatever.
Right.
If you're, you know, again, when people went out in public, when they go out to demonstrate, if they're not wearing masks, that's a big issue. And I don't just mean, you know, like demonstrating, you know, in terms of close together crowds. Even if you're far apart, you need to wear a mask. So I was
Right.
happy to see, you know, recently that when they were showing people out in the street celebrating, that most of them were wearing masks. The ones that weren't, oh, please put on a mask. Again, this is not a political issue. This is about saving yourself. There are people
Right.
on both sides of the aisles, you know, that they're not here anymore. Your grandfathers, your grandmothers, moms, dads, the little 4-year-old boy who lost his mom and his dad, you know, within months. His dad died in October and his mom just died this past week. 4-year-old, and he wants his mom.
Right.
What? This is not fair. This is not right, when all we have to do is just
wear a mask.
Wear a mask and be, you know, mindful of each other. And like the other day, I was in the airport, and I was very, very, you know, conscientious and aware. I had a cover for my, you know, my seat in my plane, but I was going down an escalator, and I allowed the person to get 6 feet in front of me before I got on. The person got right behind me. She said, "Excuse me,
Right.
can you get out the way?" I turned around and I said, I'm allowing them to social distance right now. We're
Right.
still in a pandemic. Oh, yeah, that's a good idea. Because sometimes we just don't think. I
Don't think.
she
And some
was-
people
yeah,
just want to forget that we are still dealing with the pandemic. I
exactly.
just,
Yeah, so she was getting irritated with me, but then when I said that, she's like, "Oh yeah, good idea." And her husband was like, "Yeah," like, and so she stopped, and then she gave me the 6 feet that I needed to go down the escalator. I'm like, I don't
Right.
like leaving my, you know, I don't like leaving my house for unnecessary situations, but when I have to, I will, and I will take the precautions, and I will remind people in the nicest way possible, hey, you know, let's social distance, you know.
Right.
Because,
Exactly.
yeah, and most people, the vast majority of people you come across, they're not going to be nasty. They're really not. It is about the approach. Some people are out there to prove some type of weird point. But again, I personally haven't come across anything, thankfully. So
Right. Same here.
yeah.
I know. So I want to jump now to the fact that I believe just over the past few days, there have been announcements about vaccines, one from Pfizer, one from Moderna.
Moderna.
And
Yeah.
one, I guess they're saying now is that the one from Moderna is probably going to be. Can you explain it to? I know the Pfizer one was
Right.
There was refrigeration problems with the Moderna. There's not.
So here's the thing. There's still a lot of data to be reviewed in terms of which vaccine is more effective in which population. But
Right.
the fact that Pfizer showed 90% in when they first reported, and now 95%, and Moderna is also showing 94.5%. So both of them are around the same 95% effectiveness rate, is enormous. I mean, because most vaccines, think about the flu vaccine, they're guessing.
Right.
They don't know which strain of flu is coming out. And so getting 60% effectiveness is like a slam dunk. It's a home run. But 90s, above the 90 percentile range, that's
great.
Absolutely amazing. And so, yeah, because this is an RNA vaccine, which basically, because this is an RNA virus. Okay, so nobody
now,
can
you explain what RNA is for?
So RNA is ribonucleic acid, part of your DNA, your deoxyribonucleic acid. So RNA is just a part of that. So what COVID is it's an RNA virus. It gets into your RNA, it changes it, and it infects it, and then it replicates. So this vaccine goes in and protects. I'm not going to speak on the exact mode of action because I don't know, but it's going to stop that RNA virus from getting into your RNA, your healthy RNA, and ripping it apart, turning it into something unhealthy that is bad for your body. So this targets the RNA virus. So I've heard there's a lot of weird conspiracy theories out there saying that it's going to change your genetics, it's going to change your DNA. What they're not saying is, sweetie, that's what COVID is doing. It's getting into your RNA, it's changing the genetics of that cell. Okay, it's changing the structure. So let's not be afraid. Let's not buy into these conspiracy theorists, even if some of them have what appears to be really good credentials. Right. You don't want to listen to that. Again, there's a reason that the people on the front lines, they want this vaccine. They want it first. When Dr. Fauci said, when I look at the data, if it looks safe, I'll be the first to take it, and I'll be the first to tell my family, because we do need to look at that. We need to look at the data. But so far, the experts that have seen the data, they're saying great things. But to have anything like, again, the 90s, even the 70s and 80s would have been great, but the 90s and the 95% effectiveness, and that may be because, again, this is an RNA virus and we have, our own RNA, where our own adaptability, that might be why you're seeing that rate of effectiveness. Again, I cannot speak to the mode of action specifically for either of the vaccines, but I can tell you that, wow, exciting to hear those kind of effectiveness rates. Yeah,
it is. And so this is another thing that I want to just touch on. What about those who are saying, well, I'm not going to be the human guinea pig. I'm not going to take the vaccine because it's brand new. I don't know what type of side effects they're going to, have as a result of taking the vaccine. What would you say to those individuals?
I'll say, look at the people. Okay, so it's a valid concern, very valid concern. But again, if you only have a certain population or segment of the population that's willing to take the vaccine or willing to have been a test subject, then you might have found effectiveness in one population. And we know that COVID-19 affects different races at different rates. So they needed to have a test population, people out there willing to take the vaccine from all backgrounds, especially the minority backgrounds, especially you're talking about the Asian, South Asian, Black, African diaspora, the Hispanic community, the Native American communities, the Native communities around the world, the indigenous people. They all needed to be a part of the group that was getting tested. Now, there were some, but again, the people on the front line, they fall into all of those categories. And the vast majority of them, they want the vaccine first because they deal with the patients every day. And there are some areas where, you know, they're so overwhelmed that patients are just being left to die. The worst case patients, you can, you know, the decision making that had to be made, like in Spain,
Right.
where doctors were talking about, we just had to go in and say, okay, you get to live, we can't help you, you know, because, you know, when you're overwhelmed and you don't have enough ventilators, and that's happening again in the United States,
It
in certain
is.
areas, then you as a doctor, or, you know, as a physician, you have to say, okay, I have to pick who lives or dies.
And you
It's
don't want to be put
terrible.
in that position.
You don't want to be. We've lost too many frontline workers, physicians and nurses, and staff in hospitals from COVID-19 because they got it. They're also dying. So again,
Right.
you know, if you don't want to be first in line, that is, you know, you're right. But again, you need to look at your medical history. You need to talk to your physician. You need to see how at risk you are. And you may need to get a second and third opinion, because there were people who were sent home that, again, you know, I saw that the kindergartner, she passed away from COVID-19 a few weeks ago, young African-American girl, because they told her, go home, she'll be fine, she can't get COVID. So I really believe in getting second and third opinions, because you don't have a lot of time for these, you know, for a person who's susceptible to get overwhelmed.
Right.
So again, if it's safe, if the experts say it's safe, I would be ready to take it. I have been vaccinated for, gosh, almost every kind of disease from around the world, because I have traveled around the world. And
Right.
because, again, I'm going to say this is not, I'm a federal employee. I work for NASA, but this is not an endorsement from NASA. This is Dr. Noreen, the Tox Doc, speaking as an expert on my own. But when I work in that kind of facility, I can't go to an Asia or an Africa or, you know, anywhere and not get vaccinated. It's not a choice for me. I have to get vaccinated.
You have
So I've
to.
had them,
Right.
you know, I've had them years ago. I've been vaccinated so much. I used to get the flu every single year. And then as soon as I started taking the flu vaccine every year, I stopped getting the flu.
Stop
And when
getting
I
the
tell
flu.
you, one of the worst times I got the flu, I hallucinated, and I knew I was hallucinating. I was having those really rare symptoms. I call the emergency room. I speak to an ER doc, and there's no way, and there's not possible that you're getting these symptoms. I'm like, it's literally written on the box. I know I sound insane, but I'm having
Right.
these symptoms. But you know, that's because you don't know how you're going to react. So
React. Right.
yeah, I'm not an anti-vaxxer. I am not, because I've seen people really regret that decision and lose children, lose family members because they decided not to vaccinate.
To vaccinate.
Yes. However, again, I understand that that is your decision. That's your right. But at the same time, you have to understand that the decisions you make have consequences, not just for, you know, yourself, but also for your family members who may have to now live without you and provide in
Right.
ways that you didn't intend. It also has consequences for the people on the front line that have to expose themselves to you. It's like when people don't evacuate and then they call for emergency help right before, you know,
the hurricane.
The hurricane hits, and it's, sorry, we can't go back in without
Right.
risking the lives. And so that's, you know, that's the thing to keep in mind, is that, you know, you really cannot be selfish, but you have to, again, you have to weigh the pros and cons. You have to look at the data. You have to look at the safety of it. And again,
Right.
if people who know what they're talking about, that you trust, believe in the vaccine, then take the vaccine. You know, we want people to live. We don't want people to die at the rates that they have. We want businesses to get back to, you know, the business of being business. We love American, you know, capitalism, ingenuity,
right, exactly.
mixing, partying, dancing. We want to get back to that. And the faster that we take the precautions and that we get an effective vaccine, the vaccine doesn't mean that just because you take it, you're going to be
That
cured
you won't
right
get.
away. You may have
Right.
to take a series of vaccines, which, you know, you have to do that with lots of these diseases. You take them in a series. It may not just be a one shot and done.
Okay.
So, you know, you may have to take it for 2 years. You may have to take it, you know, once every 6 months. I don't know yet. But that being said, be patient and do what you can to live. I mean, we don't like, no one's putting this out here to wipe out the population. We want the population to flourish and grow all around the world. So, you know, that's, I'm really excited to see Pfizer and Moderna, you know, and I'm not affiliated with either one of them, but, you know, and I'm not one of those who cheerleads for, you know, any company, but I will say this, I'm happy to see that kind of response to a vaccine in this kind of time period. This is unheard of.
I know. I mean, and I think that's what everybody's been saying. And I think like you said, there's been, you know, speculation as well as, you know, some hope. Like, you know, this could be it. Like, so if we start, you know, the general population starts being able to receive the vaccine. I mean, I guess that's how I kind of want to, you know, wrap up our discussion about light at the end of the tunnel.
Right.
If we are able as the general population to be able to receive the vaccination, say within the next 4 months, I don't know if that's a realistic time frame or not.
Right.
Possibly by the summer, could we be at a place where we're not having to wear masks anymore? Possibly. Maybe.
I want to say we'll be wearing masks for a while, because again, even if this vaccine is effective, there's still going to be a lot of people who aren't taking it. Okay.
Right.
And so those people can still infect. And it's like when you saw the reemergence of polio in California because some of the kids weren't being vaccinated, and you thought, oh, wait a minute, we've eradicated this. Well, you only eradicated it because kids are getting vaccinated. The ones that didn't started to spread it. And even some of the ones who had been vaccinated, you know, they were susceptible because there were carriers out there. So again, this is the, you know, and again, it all depends. I can't really predict the future, but it depends on how many people trust it, how many people take it. So the more people that get vaccinated and actually show a response, you know, a positive response, the faster we will get back to life as normal. But, you know, again, once you get back to normal, what you should not do is get back to not washing your hands. Get back to picking up stuff off the floor and putting it in your mouth. And I mean, I know people have called me a germaphobe for that, but I mean, microbiologists will tell you it takes microseconds for, there's nobody's 3-second rule. It takes microseconds for something to get infected. So, you know, I mean, wash your
realistically,
hands. Yeah. Wash your hands. I'm not saying we'll never hug again, but we'll be a little bit slower to do that. Keep the hand sanitizer on you when someone does come up and shake your hand or fist bump you or do whatever unexpectedly. You know, I prefer the elbow bump. I prefer a like forever back. Hey, how you doing? People I don't know, even though I'm a hugger. I'm a big time hugger.
I know, me too. That's my thing. But
I'm a germaphobe, but I'm a hugger. You know, and I'm not.
It's just like, okay, yeah. I still have to, you know, with my close friends, if I, you know, go, you know, might go out to a restaurant, I say, I'm guilty of doing that, but I know it's just like I've got to have to be more mindful. Like, y'all, we're still dealing with this, and the numbers are going back up. So,
and people, you know, are having events, and I'm being invited to stuff, and they're getting together, and they're taking pictures and taking off, you know, the mask. If they're just doing it for a picture real fast, and then you're backing away, okay. But most people aren't doing that. They're just taking off the masks, and they're pretending that they took it off for a picture. So again, you know, I just had to take photos for a book. Everybody had on masks the entire time. The makeup artists, the camera, the lighting, everybody had on masks, and I had on a mask except for when it was time to take pictures.
Okay.
We took the pictures, mask went off. I mean, so you just have to take precautions. And again, we won't have to wear, masks as often if we're not in, around high risk people, or we're not high risk.
Right.
But the one thing I do want to say before we wrap is that if you live in a multi-generational household, CDC a while ago said that you need to start wearing a mask at home. So Thanksgiving is next week. Winter break is coming. Kids are coming home from college. They have been around a lot of people. They may be asymptomatic, but they may be carrying and spreading. So when they get home, don't hug them. I know it's hard, but don't hug them. Don't kiss them.
Yeah, because I mean, my son just came home from college on Saturday. So yeah,
I have not been able to, hug my dad because he's in a age group that's high risk. I have not been able to hug or kiss my aunts or uncles. And
my dad is still in Ohio, and he, I haven't had a chance to go back and see him during this whole time, and especially during the holidays. And he has underlying health conditions, and he was like, "No, I don't want to risk it because we would have to fly there."
He's right, because when you come home, kids, you need to have that mask on in the house. In the house, okay? Just as a reminder, if nothing else. Don't kiss me. I'm not going to spread my, and anything when you get off an airplane, that's the main time you need to take those clothes off, put them in a baggie and isolate them until you can wash them, because you're in an enclosed environment and they're talking about these 2 to 3 HEPA air changes per minute. But an airplane is also giving you all the, air toxics of the jet fuel as well. So it's not a great clean environment to begin with. So when you get off a plane, get that stuff off of you. Again, unbag it, bag it up, isolated plastic bag until you can wash it, and put on a mask when you're home, because you haven't been around your parents and you don't want to come home and kill your parents. I literally know someone, multi-generational household, living with mom and dad. Her mom had died. She worked outside of the house. Her and her child lived with her mom and dad.
Right.
Everyone in the house got COVID. Mom didn't survive. And the dad is just devastated that his wife is gone. And the daughter is now like, I brought COVID home and it killed my mother.
And you don't want to be in that position, everybody. I mean, so again, that's why I just wanted to, again, discuss this topic, especially with our viewers, because, again, everybody is exhausted. Everybody is tired of dealing with COVID. I'm tired of dealing with COVID, but I want to live. I want my family to live. So I'm going to do whatever I need to do to continue to make that happen. And I mean, I have 50 million masks in my car, in my house. So, I mean, it's a little price to pay in order for us to be able to wake up and breathe another day. Like, I guess I was talking to somebody today and they said either 6 feet apart or 6 feet under. So which would you rather be? Exactly.
And it's like, if you care about life, if you say you care about life, wear a mask. There's nothing more, pro living than putting on a mask. Put on a mask, wear that, protect each other. We protect each other. We're in this together. We're all in this together. We are all in this together. And
we can all get out of this together if everybody does their part.
That's how we get out of it together, if everyone does their part. So, again, I'm sick of it too. We're all sick of it. I mean, imagine if you were working in a hospital and you see people just dying at an alarming rate, and you've been in that space for months, the amount of depression, how hard it is for them. Right. Guys, they're sick. There's nobody more sick of it than someone on the front lines. No one.
Exactly. And we don't want to overwhelm our healthcare systems again. Yes. So I urge everybody to please just, be cognizant, be respectful, Be concerned. Just please continue to wear your mask. Wash your hands frequently.
Yes.
And we can all get through this together. So
Yes.
I'm hopeful that these vaccines, once they're available, they will be
truly effective to the population. Yeah.
Exactly.
Mm-hmm.
Well, Dr. Noreen, I just want to thank you, my friend, my soror, for coming on,
Yes.
for coming on today and sharing your expertise and knowledge on this topic. And like I said, just giving everybody some hope that this is not going to last forever, everybody. But
yeah.
It's going to be prolonged if we don't do what we need to do. So,
yes.
With that being said, Dr. Noreen, thank you so much for coming on. My sister,
you.
I hope you continue to stay safe and blessed, as well as our viewers.
Me too.
Especially during the holiday season. Everybody,
Absolutely.
please just be cognizant. Listen to what the medical experts in the sciences are saying. I urge you, I beg you, because I want us all to be able to get together when it's safe to do it. And I know if everybody does their part, we'll be able to do it. So with that being said, I hope you guys have a safe and blessed holiday, Thanksgiving next week. I'm not going to be doing any shows. I'm going to spend time with my family. I need a break. I need a break, but but I just want to get the information out there that, people need to hear, especially from people that look like us, because like you said, minorities, African Americans are affected at a much higher rate than our Caucasian white counterparts. So I think it's just very important for us to just re-emphasize the importance of doing what we need to do in order to be able to try to get through this pandemic. So absolutely. I hope everybody has a safe and blessed rest of this Wednesday evening. And again, thank you, Dr. Noreen, again, for coming on. We will be in touch. You guys, please be sure to continue to follow me on Instagram right here at It's All Legal Too. I'm sorry, Facebook. I'm so used to saying Instagram. Follow me right here on Facebook at It's All Legal Too, as well as Instagram at It's All Legal Too. Also, please be sure to subscribe to my YouTube channel at It's All Legal Too. And I will see you guys soon. Love you guys. Bye.